My name is Dr. Adrian Cole. I've spent the last decade and a half working closely with patients before and after major surgical procedures. And in that time, I've sat across from hundreds of men and women over the age of 60, holding a consent form, nodding along as a doctor explained the procedure. But here's what I've noticed. Almost none of them were told the full story about anesthesia. Not because doctors want to hide anything, but because most of us don't slow down long enough to explain what's really happening inside your body when you go under. Today I'm going to change that. What I'm about to share with you is exactly what I would sit down and explain to my own parents before they went into any operating room. So stay with me, this matters. Let's start with something most people assume. Most people believe that anesthesia is the same for a 40-year-old as it is for a 70-year-old. You go to sleep, you wake up, surgery is done, simple. But that assumption is wrong, and in some cases, that assumption has cost people weeks of their recovery, their mental sharpness, and in serious situations, much more than that. Here is the truth. After the age of 60, your body responds to anesthesia in a fundamentally different way, not a little different, significantly different. The drugs behave differently, the brain processes them differently, the organs clear them differently, and the risks that come with anesthesia shift in ways that most patients are never warned about. Now, I want to be very clear with you. I am not here to scare you away from surgery. Surgery saves lives. Anesthesia saves lives. If your doctor says you need a procedure, you should take that seriously. What I want to do is make sure that you walk into that operating room as an informed person. Because informed patients recover better. Informed patients ask the right questions. And informed patients are far less likely to be blindsided by something that could have been anticipated and prepared for. So let me walk you through what actually happens, not the version in the pamphlet, the real version. First, let's talk about what anesthesia actually is, in simple terms, because I think a lot of people picture it as just a very deep sleep. It isn't. General anesthesia is more like pressing a pause button on your entire nervous system. Imagine your body is a large office building. Every department is running. The lights are on. Computers are active. People are talking. Anesthesia comes in and gradually dims everything. The lights go low. The computers go to standby. The building goes quiet. That is what anesthesia does. It doesn't just make you unconscious. It temporarily slows your heart, changes how your lungs function, reduces your reflexes, and puts your brain into a state that is very different from natural sleep. Now, in a young, healthy body, that building has a powerful backup generator. When the lights go down, the systems adapt quickly. The heart adjusts, the brain compensates, the recovery is fast. But in a body over 60, the backup generator has had some wear and tear. The systems are still working, they can still handle it, but they need more support, more monitoring, and more time. And that's where the difference becomes critical. There are specific things that happen to your body during and after anesthesia once you pass 60. Things that your surgical team will be watching for, but things that you yourself deserve to understand. I'm going to walk you through 8 of them, and I want you to pay close attention because some of these will surprise you. The 5th one in particular is something that patients almost never see coming, and it's one of the most important things I share with older patients before any major procedure. The first thing that happens is that your body takes longer to process the medication. In your 20s and 30s, your liver and kidneys are working at full speed. They filter anesthetic drugs out of your system relatively quickly. But after 60, those organs naturally slow down. It's not disease, it's not failure, it's aging. The liver processes drugs more slowly. The kidneys clear them from the bloodstream at a lower rate. What this means practically is that the drugs stay in your system longer than they would in a younger patient. This can make you feel groggy for hours longer than expected after surgery. In some cases, it can affect your coordination and your thinking for a full day or more. I had a patient, a gentleman in his early 70s, who had a routine knee replacement. He came out of surgery perfectly. Vital signs were excellent. But for almost 2 full days afterward, he felt what he called underwater. Everything was slow. His words came out delayed. He couldn't quite track conversations. His family was worried. His surgical team reassured them, and they were right. It was the medication clearing his system more slowly than it would have in a younger patient. He was completely back to himself by day 3. but nobody had warned him or his family that this might happen, and that gap, that lack of preparation caused real anxiety that could have been avoided. If you are over 60 and heading into surgery, ask your anesthesiologist directly. Given my age and my kidney and liver function, how long do you expect the anesthesia to stay in my system? That one question changes everything. The second thing that happens is that your cardiovascular system is under greater stress. Anesthesia affects blood pressure, it affects heart rate, and it affects how blood flows through your body. In a younger patient, the cardiovascular system adapts quickly to these changes. But after 60, particularly if you have any history of high blood pressure, heart disease, or even just the natural stiffening of blood vessels that comes with age, those adaptations are slower. During surgery, blood pressure can drop, sometimes significantly. The anesthesia team monitors this constantly and corrects it, but the stress on the heart during that period is real, and for older patients, it deserves attention and preparation. Studies have shown that cardiovascular complications account for a significant portion of surgical risk in patients over 65, not because of the surgery itself, but because of how the heart and blood vessels respond to anesthesia and the physical stress of the procedure. What can you do? Before surgery, make sure your cardiologist and your surgeon are talking to each other, not just sending notes back and forth, but actually communicating about your specific situation. If you take blood pressure medication, ask very specifically whether you should take it on the morning of surgery. The answer matters, and it varies. The third thing is what happens to your temperature regulation. This one surprises a lot of people. Under general anesthesia, your body loses its ability to regulate temperature normally. You stop shivering, you stop sweating, your internal thermostat essentially goes offline. Operating rooms are cold, and for an older adult under anesthesia, that cold can become a real problem. When the body cools significantly during surgery, it's called hypothermia. Even mild hypothermia during a procedure can slow healing, increase bleeding risk, and affect how the heart performs. Older adults are particularly vulnerable to this because the ability to regulate body temperature naturally declines with age even before anesthesia enters the picture. Modern surgical teams are very aware of this. Warming blankets, warm IV fluids, and careful monitoring of body temperature are standard in good facilities. But it's worth asking about. Ask your surgical team what their protocol is for temperature management during your procedure. It's a simple question, and the fact that you're asking it tells your team that you're paying attention, which, I promise you, is never a bad thing. Now we're at the fourth thing, and this one involves something most people don't think about until it's already happening. It's the effect of anesthesia on your breathing. When you are under general anesthesia, you cannot breathe on your own. A machine breathes for you. A tube is placed in your airway, connected to a ventilator, and your respiratory system is essentially managed externally for the duration of the procedure. For most people, this is handled seamlessly and they never think about it afterward. But for older adults, particularly those who have any history of lung conditions, sleep apnea, or even just the natural decline in lung capacity that comes with aging, the transition back to independent breathing after surgery deserves attention. Post-operative breathing complications are more common in older patients. This includes things like fluid in the lungs, shallow breathing that doesn't fully oxygenate the blood, and in some cases, a need for extended oxygen support after the procedure. None of these are automatic. None of them are inevitable, but they are more likely than in younger patients, and knowing that going in allows you to prepare. If you have any history of breathing issues, even mild ones, tell your anesthesiologist everything. Don't minimize it. Don't assume it's not relevant because it's been controlled or because it doesn't bother you day to day. In the context of anesthesia, that history matters. Now, here we are at the fifth thing, the one I mentioned earlier, the one most people never see coming. And I want you to really listen to this one because it affects a significant percentage of older adults after surgery, and almost nobody talks about it before it happens. It's called post-operative cognitive dysfunction, and in simpler terms, it means that after surgery and anesthesia, some older adults experience a noticeable change in their thinking, their memory, and their mental clarity. This can show up in different ways. Some people feel confused, some have trouble remembering recent conversations, some notice that their thinking feels slower, foggier, or less sharp than it was before surgery. Some have difficulty concentrating on tasks they used to do easily. Now, I want to be precise here because this topic deserves precision. In many cases, this cognitive change is temporary. It lasts days or weeks, and then it resolves. But in some older adults, particularly those who already have early signs of cognitive decline or other risk factors, this effect can be longer lasting. Research has indicated that post-operative cognitive dysfunction occurs in somewhere between 10 and 30% of older surgical patients, depending on the procedure, the patient's health, and other factors. I've had patients describe it to their families as not feeling like myself. A woman in her late 60s came to me 3 weeks after an abdominal surgery. She had recovered physically, her incision was healing well, her vitals were normal, but her daughter brought her in because she said her mother wasn't the same. She was forgetting appointments, she was struggling to follow the plot of the television shows she had always watched. She was more irritable, more anxious, and quieter than usual. She had not been warned this could happen, neither had her daughter, and so both of them spent those weeks frightened, wondering if something had gone terribly wrong, not knowing that this was a recognized, documented effect of anesthesia in older adults. She improved. Gradually, over the following weeks, her cognition returned to its baseline, but the fear and confusion of that period could have been significantly reduced if someone had simply told her in advance, "This might happen, here is what it looks like, here is what you should do if it does." If you are over 60, or if you are caring for someone over 60 who is heading into surgery, please write down this term, post-operative cognitive dysfunction. Ask your doctor about it. Ask what the risk is for your specific situation. Ask what the signs are and what to do if you notice them. The sixth thing that happens is something that occurs more in the hours immediately following surgery, but it can have ripple effects on recovery. It's called post-operative delirium. And it's different from the cognitive dysfunction I just described, though the two can overlap. Delirium is an acute state of confusion. It can come on suddenly, sometimes within hours of waking from anesthesia. A person experiencing delirium may not know where they are. They may be agitated. They may see things or hear things that aren't there. They may swing between extreme alertness and deep drowsiness. In older adults, post-operative delirium is actually more common than most families realize. It affects roughly 1 in 5 older adults after major surgery. Imagine how frightening that must be, both for the patient and for the family watching it happen. Imagine waking up from surgery, not recognizing the room you're in, not recognizing the nurse standing next to you, and feeling a kind of fear and confusion that you can't explain or control. The good news is that delirium is usually temporary and manageable when the medical team is prepared for it. But it's the kind of thing where preparation matters enormously. If your family knows that delirium is a possibility, they can respond with calm, familiar voices and faces rather than with panic. Something as simple as having a family member present in the recovery room, speaking in a calm and familiar tone, can make a meaningful difference in how quickly a delirious episode resolves. Ask your surgical team about delirium prevention protocols. Some hospitals have specific programs in place for older patients. Ask what the visiting policy is during recovery. Ask whether a family member can be present as you wake up. The seventh thing involves your muscles, and this is one that catches many people off guard because it continues well after the surgery itself is over. Anesthesia and the experience of surgery, particularly longer procedures, can contribute to what's called post-operative muscle weakness. Some of the medications used during anesthesia temporarily block the signals between your nerves and your muscles. This is intentional during surgery. It prevents involuntary movement and keeps the surgical field stable. But the reversal of this effect is not always complete or immediate in older patients. After surgery, some older adults find that their legs feel weaker than expected. Getting up from a bed or a chair feels harder than it did before. Balance is affected. The risk of falling in the first days after surgery is higher than usual, not because of the surgery on the joint or tissue, but because of the residual effects of anesthesia on the neuromuscular system. Add to this the fact that even a short period of bed rest, the kind that's often required after surgery, causes muscle loss more rapidly in older adults than in younger ones. A 65-year-old can lose a meaningful amount of muscle mass from just a few days of complete bed rest. This is not a reason to avoid necessary surgery, but it is a reason to think very carefully about physical rehabilitation as part of your recovery plan, starting before surgery, not after. Ask your doctor whether pre-surgical physical therapy is appropriate for your situation. Strengthening the muscles around the area being operated on, and strengthening your overall body before surgery is one of the most evidence-supported things an older adult can do to improve surgical outcomes. It's called prehabilitation, and it matters. The eighth and final thing I want to walk you through is something that operates quietly in the background, rarely discussed, but worth understanding. It involves your immune system. The stress of surgery, combined with the systemic effects of anesthesia, temporarily suppresses immune function. Your body is directing all its resources toward healing the surgical site, and in that window, its ability to fight off other threats, like infections, is reduced. For older adults whose immune systems are naturally less robust than in younger years, this window of vulnerability is longer and more significant. Post-operative infections, pneumonia, and urinary tract infections are more common in older surgical patients in part because of this immune window. A hospital stay extends that vulnerability because hospitals, despite best efforts, are environments with a higher burden of infectious agents. This is not a reason to avoid surgery. It is a reason to pay attention to signs of infection in the days and weeks after you return home. It is a reason to follow your wound care instructions carefully. It is a reason to wash hands diligently, and it is a reason to tell your recovery team immediately if you develop a fever, if a wound looks red or swollen, or if you feel suddenly worse after a period of improvement. Recovery is not a straight line, but knowing what to watch for makes you a much more effective participant in your own healing. Now, I want to take a moment and check in with you. We've covered a lot of ground, and I want to be honest with you about something important. Everything I've described, every single one of these 8 things, is a known, documented, manageable aspect of anesthesia in older adults. None of them are automatic. None of them are guaranteed to happen to you. Many older adults go through surgery and anesthesia and recover smoothly and fully. The point of walking through these risks is not to fill you with dread. The point is to give you the knowledge you need to have real conversations with your medical team, to prepare your body and your support system, and to recognize what's normal if something unexpected happens. Knowledge is not fear. Knowledge is preparation, and preparation changes outcomes. So let's talk about what you can actually do, because this is the part of the conversation that I consider the most important. Not the list of risks, but what you do with that information. This section I call, What I Tell My Own Patients Before Surgery. The first thing I tell every patient over 60 is this: have a dedicated conversation with your anesthesiologist before the day of surgery. Not a 5-minute hallway conversation, a real sit-down conversation. Your anesthesiologist is one of the most critical members of your surgical team. In some ways, they are the person most responsible for keeping you safe during the procedure itself, and yet many patients never meet their anesthesiologist until the morning of surgery in a preoperative room with very limited time to ask questions. If at all possible, request a pre-surgical consultation with your anesthesiologist. Bring a list of every medication you take, including supplements and over-the-counter drugs. Bring your health history. Ask about the specific plan for your anesthesia. Ask about the risks given your age and your specific health profile. Ask whether any of the things I've described today are particular concerns in your case. This conversation can change your care in meaningful ways. The second thing I tell my patients is to take their medication list seriously. Certain medications interact with anesthesia in ways that can create real problems. Blood thinners, blood pressure medications, diabetes medications, certain supplements like fish oil, vitamin E, and ginkgo biloba, all of these can affect surgical risk. The standard advice is to give your doctor a complete list and let them guide you on what to stop, what to continue, and when, but I want to be more specific than that. Don't just hand over a list. Discuss each item, ask why you should stop something if that's the recommendation. Ask how stopping it might affect your underlying condition. Make sure the left hand and the right hand of your medical team are talking to each other. The third thing is what I call cognitive preparation. If post-operative cognitive dysfunction is a concern for you, based on your age, your health, or a family history of cognitive decline, discuss it explicitly with your team before surgery. Ask whether there are anesthetic approaches that carry a lower cognitive risk. In recent years, there has been growing research suggesting that regional anesthesia, where only part of the body is numbed rather than putting the whole body under general anesthesia, may carry lower cognitive risk for some older patients in some procedures. This is not always an option, but for procedures where it is worth asking about. The question to ask is simple. Is regional anesthesia an option for my procedure, and would it be appropriate given my situation? The fourth thing I tell patients is to prepare their home and their support system before surgery, not after. This sounds simple, but the number of people who come home from surgery to a situation that wasn't ready for them is remarkable. Think practically. If you are having a lower body procedure, will you be able to navigate stairs at home? If you are having an abdominal procedure, who will help you for the first week when bending and lifting are restricted? Is your bathroom set up safely with grab bars if your balance or strength will be temporarily reduced? Do you have someone who can stay with you or check on you daily for at least the first week of recovery? Have you arranged transportation to follow-up appointments? These are not dramatic concerns. They are practical ones. And addressing them before surgery, not scrambling to figure them out while you're recovering, makes a significant difference in both safety and stress. The fifth thing is sleep. I know this sounds almost too simple, but the quality of your sleep in the weeks before surgery matters for your recovery. Sleep is when your body repairs tissue, consolidates immune function, and processes stress. Patients who are sleeping well before surgery consistently have better outcomes than those who are sleep-deprived going in. If you have trouble sleeping, if you have undiagnosed sleep apnea, if your sleep has been disrupted, bring that up with your doctor before your procedure. It is more relevant than most people realize. The sixth thing, and this one is for the people who are supporting an older adult through surgery, is to educate yourself alongside them. If your parent, your spouse, your sibling, or your friend is having surgery, go to the appointments with them, sit in on the consultations if possible. Take notes, understand the recovery plan, know what the warning signs are, know what to do if something doesn't seem right, and above all, don't let your loved one feel alone in navigating this. The research is consistent. Patients who feel supported during surgical recovery heal faster, experience less post-operative anxiety, and report better overall outcomes. Your presence matters, your attention matters. The seventh thing is about expectations and patience. Recovery after surgery, especially for older adults, takes time. The body is not as quick to bounce back as it once was. That is not failure. That is not a complication. That is reality. And when patients and families understand that the timeline for full recovery may be longer than it was for a younger relative or a younger version of themselves, they approach recovery with patience rather than panic. They don't interpret normal slowness as a sign that something is wrong. They give the body the time it genuinely needs. Be patient with yourself. Be patient with your recovery. Celebrate small milestones. Getting out of bed, walking to the window, eating a full meal, holding a conversation without fog. These things matter. Notice them. Before I close, I want to come back to something I said at the very beginning. I said that almost none of the older patients I've met were told the full story about anesthesia. And I want to say clearly, that is not because the medical community is indifferent. Most surgeons, anesthesiologists, and surgical nurses genuinely care about their patients. But the system moves fast. Appointments are short. The focus is on the procedure itself, and the softer, less visible effects of anesthesia can fall through the cracks. You being here, watching this, reading this, taking the time to learn, that already changes your position. You are no longer walking in uninformed. You know what questions to ask. You know what to watch for. You know how to prepare. And that knowledge puts you in a fundamentally better position than the person who shows up on the day of surgery with no context and no vocabulary for what they might experience. I've seen the difference that preparation makes. I've seen patients who walked into difficult procedures and recovered with fewer complications, less anxiety, and more confidence, simply because they had taken the time to understand what was going to happen. And I've seen patients who were blindsided by something that was entirely predictable, who spent days or weeks frightened when they didn't need to be. You don't have to be in that second group. Let me leave you with a summary. When you go under anesthesia after 60, your body takes longer to clear the medication. Your cardiovascular system is under greater stress. Your temperature regulation goes offline. Your breathing requires full mechanical support, and the return to independent breathing may take more support. There is a real and documented risk of cognitive changes after surgery that may be temporary or, in some cases, longer lasting. There is a risk of short-term post-operative delirium that can be managed when families are prepared. Your muscles are more vulnerable, both to the neuromuscular effects of anesthesia and to the rapid muscle loss of bed rest. And your immune system enters a period of reduced function that requires attention and awareness. None of these are destiny. Every single one of them is something you can discuss, prepare for, and in many cases significantly reduce through proper preparation and communication with your medical team. Have the conversation with your anesthesiologist before the day of surgery. Bring your full medication list and actually discuss it. Ask about cognitive risk and whether regional anesthesia is an option. Prepare your home and your support system in advance. Prioritize sleep before your procedure. Involve your family or support person in the process. And give yourself permission to take recovery slowly, because your body is doing real work, even when it doesn't feel like it. If this information helped you or someone you love, consider sharing it with someone who is preparing for surgery or someone who is caring for an older adult going through a procedure. The more people who walk into that operating room informed, the better the outcomes will be. That matters to me, and I hope it matters to you too. Take care of yourself. Ask the questions. You deserve honest answers.